On this video, I will be talking about attention deficit hyperactive disorder, simply referred to as ADHD. Sometimes it's also called attention deficit disorder, ADD. Now, this is the second of a three-part series on this subject. In this particular video, I will be talking about the signs, the symptoms, and the subtypes of attention deficit hyperactive disorder. There are three core features of this condition. Number one is inattention or inattentiveness. Number two is impulsivity. And then number three is hyperactivity. Just listing these three symptoms, it may sound not very disturbing. You may wonder what is really the big issue with attention deficit hyperactive disorder. I will go ahead to explain it using 7 different features coined out of these core features to explain how it looks like in an individual. Number one, people with attention deficit hyperactive disorder often find it difficult to stay focused. In other words, they find it difficult to pay attention. Now, sometimes they are able to sustain their attention, especially when they are dealing with something that they are quite interested in. But when people with ADHD find themselves in a situation where they are not necessarily interested in the subject, they find it quite difficult more than other persons to sustain their attention and to pay attention. Number two, they often get easily distracted. So the person with ADHD, like every other person, may experience moments where your mind wanders away from a conversation to something that could happen later or something that happened before. Now, normally when that happens for the regular person who does not have this condition, the person is able to bring their attention back to the subject matter or what is going on in the present and in the here and now. But the person with ADHD often finds it very, very difficult to just go there and be easily distracted in their mind and come back. Often they find it difficult to come back to the subject matter. So they go on daydreaming and just stay focused on events that are not currently happening. Now, Dr. Thomas Brown, a renowned expert on ADHD, described it this way. He said, it's not really a problem of inattention, but really more of a problem of regulating attention. Because for the person with ADHD, it's almost, he described it this way. He said, it's like someone watching several channels at the same time and then finding it difficult to regulate which one would I put my attention on. Number three, the person with ADHD often finds it difficult to stay on the task. So they find it difficult to pay attention, they get easily distracted, and it's difficult to just stay on the task, especially when it's a repetitive task or when it's a long-term task. So you often find people with ADHD struggling with schoolwork, struggling with at work, especially when there's no form of supervision. They struggle with that. It's not something they bring on themselves, it's not something they like to do, but it is just the way the brain is wired, and therefore it makes it difficult for them to stay on the task. Number four is that people with ADHD often find it difficult to be organized. So you may walk into the room of somebody with ADHD and you'll find his room cluttered, scattered more than the usual, and you'll find their tables disorganized. Now, sometimes you have people with ADHD, they could have situational changes. What I mean by that is that in certain situations you may not see these things, and then in other situations, so you may come to the office of the person with ADHD, may be organized there, but then you go to his home and then you go to his bedroom and it's disorganized there. But often you see some level of disorganization that goes with the condition ADHD. Number five, they often have problems starting. So starting is a big deal for the person with ADHD. That's getting on the task. So you will find the individual often procrastinating, often pushing off the task, often pushing off that assignment, rather than just getting on to do the task. It could be quite frustrating for them and for those around, because you often just feel like, why don't you just get it done? But you see, the person with ADHD literally struggles with that. So you find them procrastinating, and except when there seems to be like a crunch time, where there seems to be like an emergency to the situation, that's when you find the person rising up to the occasion to get the task done. But otherwise, it's a lot of challenge to just get up and go with the task. Number 6 is that people with ADHD often also struggle with managing their emotions. Remember that ADHD is no longer just seen as a behavioral problem, rather it's seen as a problem in the executive management system of the brain. That means the part of the brain that serves for executive functioning, which has to do with decision making, which has to do with planning, which has to do with organizing. It is said that there is a dysfunction going on in that aspect of the brain. That is why the person with ADHD literally struggles with these things. And therefore, because they are struggling with these things, when it comes to their emotion, that capacity to be able to manage their emotion can be difficult for the person with ADHD. So, and this is quite important. This is so important to take note of, because people with ADHD often may be fidgety, may find themselves often anxious, may find themselves struggling with depression, and sometimes may be misdiagnosed to having depression or anxiety, whereas the real problem is the ADHD. So please take note of that. The 7th and the last but not the least is that there is a problem with something called working memory. Working memory just simply is that part of your memory that helps you with planning. So the individual with ADHD struggles with planning. You often find the person struggling with being able to keep up with appointments, being able to schedule. So you have issues on time management and planning. It's all back again to the executive functioning of the brain. Based on the 3 core features of attention deficit hyperactive disorder, which are inattention, hyperactivity, and impulsivity, there are 3 major subtypes. The first is the predominantly inattentive type. The second is the predominantly hyperactive impulsive type. And the third is the combined type. The subtypes are really based on the predominance of the features or the symptoms in the particular individual. I hope this video has been helpful. Watch out for the 3rd part of the 3-part series on ADHD. Please spread the word, and just in case you've not subscribed already, kindly do so. That way you don't get to miss out on any of our videos. Thank you very much.